So now we will be checking the C6 myotome, that is the wrist extensors. So the patient's arm will be fully extended and adducted and the forearm will be pronated. Now I will stabilize his forearm and stabilize his wrist joint and hold his wrist joint like this so that the wrist gets passively flexed. And now I will ask the patient to extend his wrist joint. If the patient is able to extend the wrist joint at this position, that means the power is grade 3 for C6 myotome. Next, I will tell the patient to keep his wrist extended and now I will apply some force on his wrist. So if the patient can extend further against moderate resistance, that means the power is grade 4. And if the patient can extend against maximum resistance, that means the power is grade 5. So now we'll go ahead and do testing for grade 2 and grade 1. Now we will have to eliminate the gravity. So either we can place the arm in the mid pronated position, that is in the neutral position in which the gravity gets eliminated, and we tell the patient to extend his wrist. That is grade 2 power. Or otherwise we can place the arm and the forearm on the patient's body and then ask the patient to extend the wrist at this point. This is also grade 2. If the patient is not able to do this movement in this position as well, that means the power is less than grade 2 and we need to palpate the wrist extensors. And if the wrist extensors are moving on passive wrist extension, that is grade 1 power. We need to take care of one important point in this examination is that we need to stabilize the patient's forearm and the wrist joint. Otherwise, the movement at the forearm like supination can mimic the wrist extension and hence we can wrongly grade the power. So if we stabilize his forearm and wrist, so the patient can only extend the wrist at this position and hence we can be firm that the patient's power is grade 2 or grade 3 and we won't be wrongly grading the power. Thank you.